Thanks so much for doing this and welcome to the interview. Has COVID-19 raised the profile of vaccination across all ages and stages of life in your country?
Personally, I think that COVID-19 has definitely raised the profile of vaccinating across all ages, especially for older age groups and vulnerable groups. COVID-19 has undoubtedly raised the profile of vaccination at all age groups. Whether it has raised the principle of life course immunization per se is more debatable, but the profound seriousness of COVID's impact on older people and hence the burden on the healthcare system directed the government to organize vaccination program that is age profile. Of course, we still do not have all the data which is required, but the Croatian Institute of Public Health has released data that 90% of population covered by life course immunization programs receive needed vaccination. So definitely, to sum up this part, I think that the profile and this topic has been raised in public debate. Whether it is a good thing or not, that's also debatable. But of course, that's one side. But on the other side, the fact is that we had the decrease in level of the healthcare services in general because of the pressure that was put on the healthcare system, but by COVID-19. So I think within this context, we can say that the system is conducting what it should, and that we are kind of on similar numbers that we had before the pandemic. I would also like to point out that some diseases like flu are much less prevalent now. We see that in my country because of people reducing contacts, reducing social life because of all the restrictions, etc. And this is also something that needs to be taken into account. So already last year we had much smaller number of cases of flu, and of course that has also kind of influenced the overall atmosphere on the necessity to vaccinate for this. So we have to take all of this into consideration when we discuss data, but I think in general that definitely immunization, vaccination in general is now much more present in the public debate than before.
How has the government and your fellow citizens responded to COVID-19 vaccination?
That's a very good question. What the government has done, it has put a strong emphasis on securing enough stockpile of vaccines to vaccine entire population, and we did that by the summer already, summer of 2021. So I think that the government has done as much as it was physically possible. So the government secured all the vaccines and started a strong information campaign to motivate people to vaccinate. On the other hand, in the population, we had many problems, many issues. We had very strong, unfortunately, anti-vaccination manipulation from the social media, social networks, etc. So which has also unfortunately been supported by some opposition politicians as well, who have been spreading false information, fake news across the public, and that has been a major problem. But now, when we have entered the fourth wave of the pandemic, I think that people now have realized the dangers of not being vaccinated. So actually, the vaccination rates have really increased in the last several weeks. So this is a good development. So we are currently at around 50% of adult people, of all the entire population which is vaccinated, and around 60% of adult people. So this has improved in the last month or so, but we are definitely still not there yet. We are one of the worst countries in the European Union in terms of vaccination percentages. So I think that we will have to do much more, especially in spreading the information on why vaccination is important, and to combat fake news and political manipulation, which we can see every day in the public atmosphere. Also, the government is definitely doing its utmost to promote vaccination and to protect the lives of people, but we have this problem of political groups and other interest groups using the modern media and the possibilities to spread fake news, which is a big problem.
What needs to happen post-COVID to encourage life course immunization and vaccine programs in general that make health systems more resilient?
In general, we have to promote immunization, vaccination much more than before, because now everything is taken for granted. The results of the vaccines, the eradication of some of the diseases which were extremely dangerous 50 or 60 or 70 years ago has not been taken for granted. So nobody is thinking of the causes why these diseases are not present in the population anymore. So I think we have to educate people more. We have to look at our education sector, and we also have to realize that immunization is the most cost-effective means to maintain public health. So that's also something which is very important. It's not mentioned that often. So immunization, vaccination is much cheaper than treating the patients, than treating the disease once it spreads. So this is also very important for policymakers to realize, and also because the more we invest into vaccination, the less costs we'll have afterwards. So I think this is important. So I think that we have to remind everybody about the results of the vaccination, of the importance of vaccination, and the fact how it affects the public health in general, but also especially even the cost of the healthcare system, which I think also very important. We need to also apply the lessons that we learned from COVID-19 vaccination to other types of immunization as well, because the people, the anti-vaxxers, the people who are spreading false information, who are manipulating the public, will not go away. So once hopefully COVID-19 pandemic is finished, they will probably shift to other types of vaccines and other types of public health interventions. So we should definitely also figure out long-term and systematic ways on how to prevent this false information from spreading.
Finally, is there anything the EU can do to support life course immunization?
Of course, you know that public health in general, but especially vaccination, is primarily a national competence. So member states have the autonomy to decide on the organization of their healthcare systems according to Article 168 of the treaty, and also on how to finance this. And of course, since these kinds of campaigns need to be financed, so it is the member states to define their priorities on their own. So European Union cannot force them to change their priorities or something like that. What the EU can do, however, it can support national policies. And one good example is in the area of HPV vaccination, where in the Europe's Beating Cancer Plan, we have a target of reaching 90% of target population, that's the young girls under the age of 15, to be vaccinated for HPV. So EU can have this kind of targeted actions. EU can financially support national policies. And of course, what is very important is that now we have the EU for Health program, which is the budgetary program for healthcare in the next 7-year budgetary period, which is 12 times bigger than the previous health program in the previous budget for the period 2014 to 2020. So we had 12 times more money for healthcare on the level of the European Union, and we should use this funding to also support national actions and national campaigns for life course vaccination. So I think that EU cannot force member states or force some other priorities upon the members.